Hey guys, I'm Dr. Krueger here at Rice Village Animal Hospital. I'm the practicing medical director, and I've got myself and Leslie here. She's our lead veterinary technician, and we wanted to chat here a little bit about dental disease in dogs, and we have some questions that we already had lined up, and so Leslie's going to read those to me, and here we go.
Dr. Krueger, how does the state of a dog's teeth affect their overall health?
So the state of their teeth affects their overall health in a lot of ways, and I think in a little bit we'll kind of get into that. But it can affect the way they eat, they can lose weight, it can affect other organs like the heart, liver, kidneys, and also just a general discomfort is another big thing that can affect.
What dental diseases or complications do dogs commonly encounter?
So kind of the things that I see on a regular basis would be more of just severe periodontal disease. So just dogs having a lot of tartar and plaque buildup that's affecting their gums and the rest of their mouth. And then also like some younger dogs will still run into stuff where, let's say they do something, they have a trauma and they fracture a tooth. And so that's another big thing that they can run into that we need to take care of rather quickly. But those are probably the most common two things that we run into.
What causes dental disease in dogs?
The cause for that is bacteria, and so the bacteria in the mouth is normal, but what happens is on the teeth, it builds up a biofilm, which is the plaque or the tartar, that hard stuff that you'll see on your dog's teeth, and so it's caused by, long story short, it's caused by bacteria.
What are the most common signs or symptoms of dental diseases in dogs?
The most common signs that you'll probably notice at home are going to be bad breath. That's probably the first thing that people talk to me about. Or if they are having problems, they're not chewing on things that they normally chewed on in the past, like hard toys, or if they don't chew on one side of their mouth or not, which I know sometimes that can be hard to see, but those are little things to look for.
What are some of the reasons my dog is losing teeth?
The main reason I'll see dogs that are losing their teeth is just really severe dental disease, and so we will see that. It's usually years and years in the making. It's usually not something that happens overnight, and so that kind of starts with dental care when they're younger.
Is there a specialist my dog needs to see in order to get dental care?
That is a good question. Most people don't know that there's actually veterinary dental specialists, or veterinary dentists, I should say, and we have several around our area that we can refer to. We can also call them and ask them questions, but I would say they will take probably more of the complicated cases. Most general practitioners like myself and here at Rice Village Animal Hospital, we can take care of a majority of dental issues, cats or dogs. But yeah.
Do dog teeth fall out?
Dogs' teeth do fall out. As a puppy, they should all fall out, which is something that not all puppy teeth do, which is something we need to take care of, but also when they're not supposed to, so older dogs, they may fall out at that point, which then you have a problem with that. So early on in life, that's a normal thing. Puppy teeth will fall out kind of starting between 3 months old up to 6 months. Sometimes that age group can change a little bit, but that's the majority.
Are certain dog breeds more likely to develop dental problems?
Yes, we will notice that typically in dogs, it's generally our smaller toy breed dogs that have worse mouths and dental disease, and we think that's probably due to genetics and maybe the ability of the owner not being able to do stuff with their mouth like brushing teeth or stuff like that, or they don't want to eat the treats that we give them that help keep their mouth healthy.
What should I do if I see plaque or tartar on my dog's teeth?
I think the first thing you should do is talk to your vet, because if you see plaque or tartar, that's kind of the start of the process. It may not be an emergency off the bat, but it's a good thing to get a plan with your veterinarian to see, is this something I need to take care of now, or is this something that we can, push off a couple months? Because any tartar is going to turn into a problem at some point in their life.
How much does a dental cleaning under anesthesia cost?
A dental cleaning under anesthesia generally varies, and there's some factors that go along with that, but the range that we usually have is anywhere between about $700 and $1,000, and that's for uncomplicated dental cleanings. And then it can get a little bit more, the range can change a little bit, but it's something that it's hard to give an exact cost on, because if there's a lot of oral surgery or dental work that needs to be done, that's kind of what changes the estimate. But for an uncomplicated case, that's probably a good range.
What are some of the things I can do to prevent dental issues for my dog?
That's a great place to start, Leslie. So where I'd start is as a puppy, getting them used to you brushing their teeth and taking oral treats. And so oral health treats like Greenies or Oravet, and getting them used to those things, because if you don't, then it can be a problem later on in life. It's easier to teach a puppy that and rewarding the behavior with treats or a toothpaste that tastes good to them. Yeah.
How can I care for my dog's teeth at home?
Yeah, that's a great question. So the biggest thing we look at is brushing. I know we said that a little bit earlier. And there's a great website, VOHC, Veterinary Oral Health Council.org. And that's a fantastic place to look at a lot of different options for ways to care for your dog's teeth. The best thing you can do is going to be brush their teeth. Get them used to it early on, like we said a little bit before, and using a toothpaste that's fluoride free. And really, if they don't like that and you can't get it done, just work slowly with them. Don't try to brush their whole mouth at the same time. Split their mouth into kind of quadrants like this and start with one and then reward them for it, and then work your way to that over several weeks or months.
How often should I be brushing my dog's teeth?
I would try to do it every single day to get yourself in the routine of it and get them in the routine of it, because dogs are creatures of habit just like we are. And if we don't do something every day, it's really hard to get in that routine. So doing it every day is the best thing for them, just like we do it for ourselves twice a day, and sometimes people do it more than that.
Can I use a human toothbrush and toothpaste for my dog?
I would check out the vohc.org website. They do have some good products there. I would not use a human brand toothbrush or toothpaste. The toothbrush is a little bit more, there's a lot of different options out there, and so you just have to find one that works best for you and your pet. But the toothpaste is very important because they're going to eat it. So you do not want them to eat the fluoride toothpaste, which is in a lot of common in human toothpaste. Don't want that, because over time, over a long period of time, they eat too much of it, they can get fluoride toxicosis, which can be a problem. So just avoid it altogether.
How can I clean my dog's teeth without brushing?
Yeah, so there's not really a good way to clean their teeth without brushing. There are some dental wipes you can get. They don't really work as well as brushing, and so I think it's just more of a matter of training them, positive reinforcement to get them to the point to allow that. Now, if they don't let you brush them, there are treats out there, and so the VOHC website is a fantastic place. And you know what? If you can't find anything, just give us a phone call and we can help guide you through that.
How do I know if my dog needs to have its teeth professionally cleaned?
Things I would look for, and I actually have a model here for you guys. So this is a little bit extreme, but on this side you'll see that there's some red lines on the gums, and this is a pretty severe case in here just because it's a model. And so the red line is the gingivitis that's right here. So what you'll do is you just flip your dog's lip up and you look at their teeth, and then go to the back, because the front might look fine, but when you look at the back teeth back here where they chew with, that's where a lot of dental tartar and calculus builds up. But really, if they have dental calculus and tartar or gingivitis, that's kind of what we're looking for. And if you really are worried about it, ask your veterinarian and take them in, and it's a very quick appointment generally.
Does my dog need to go under anesthesia for a dental cleaning?
Yes, so your dog is going to need to go under anesthesia for dental cleaning. I know you'll read stuff about the anesthesia-less dental cleanings out there. The tough thing with that is there's no way you're going to get their teeth cleaned correctly, especially under the gum line. I don't know of any person that's going to be able to do that without actually anesthetizing a dog or doing it correctly. And the experience I've seen from patients that have gone is they get terrified because they're held down to do it, or it's not done correctly, or the dog's injured. So I would really highly recommend not doing it. I don't care how good you feel like your dog would be with it. It's not worth it, and there's no way they're going to be able to get dental radiographs on them as well, and there's a whole procedure that's done with that you're really missing. So you're missing a lot of information when you don't put them under anesthesia.
What should I expect for my dog to experience during a dental cleaning procedure?
Yeah, so generally here, we'll go over that with you if you make an appointment. We have that scheduled, but just a quick rundown is it's a whole day outpatient procedure. So they get dropped off in the morning, and then they go home in the evening. And so they go under anesthesia. We generally will have blood work run beforehand or during the day of, and then they'll go under anesthesia. They will be placed on a machine that will help regulate their breathing and everything like that, and keep water from getting down into their lungs, so they will be intubated for that. And then we scale and polish the teeth just like me and you have done at our dentist. We just don't have to get knocked out for it. And at that time, we do dental x-rays as well. And a lot of times we can find problems. And in dogs, I think the statistics out there right now are about 35% of dogs will have some sort of disease under the gum line. You will not see unless you do those dental x-rays. So we highly recommend doing that. We usually call you, update you along the way, let you know how your pet's doing, just because they're family members. And so we just want to make sure you guys don't have hesitations over the anesthetic protocols. And so if you have questions, absolutely bring them up to us. Ask us that. We're more than happy to talk to you about it. And at the end of the day, they go home with you, and they may act a little funny just because they were on some drugs for anesthesia, but all dogs typically do very well with it afterwards. And we'd be more than happy to chat with you about that. And definitely, if you guys have any questions, any concerns at all, feel free to give us a phone call. We can either talk with you or have you guys come in for an appointment. If you're worried about your dog's teeth, it's probably better to see them. And give us a phone call. Phone number 713-527-0489. And we're always here for you. Thank you.